5 minutes after 11 o'clock. Beautiful Thursday. It's the 5th day of the year. Perhaps you made a resolution that this would be the year you lose weight. Perhaps you've heard about bariatric surgery procedures and as an option for those who want to lose weight. And maybe you've just never really known. Is it scary? Is it the same as it was when your great uncle had the procedure done 20 years ago? Lauren Debick is here, and Lauren is the manager of marketing communications at Ocala Health, and she brings us some great guests, and she's brought a repeat guest. Dr. Reginald Griffin is in the studio, general surgeon specializing in minimally invasive, those two words are important, bariatric surgery, those two words are important, at Concierge Bariatrics. Good morning to you, Dr. Griffin, and to Lauren. Good morning, both of you.
Good morning. Good morning.
Good to see you. Happy New Year.
Happy New Year.
So do you have people who come to you for bariatric surgery who really aren't good candidates? Like, who's not a good candidate for this?
Good question. It is important to at least consult with the bariatric surgeon because the average person usually doesn't know. Patients that are not good candidates, typically age is a important question. Any patient with advanced age, anybody getting older than 70, really starts driving some concern.
I'm glad it was a number higher than mine.
The oldest I have done a bariatric surgery on is a patient that was 70 years old,
really?
And they did very well. But age is a consideration. Other things, if they have a lot of diseases that might not be safe for anesthesia, if they've had coronary artery disease, or if their heart function isn't that great to withstand the general anesthesia for the operation, we have to be careful with those patients.
I don't know if this is an awkward question or not, but I mean it in all sincerity. I have a tendency for people to think I'm silly, but here it is. When I look out the window and I see people who are obese, the fat is distributed differently on different people. So does the distribution of the fat make a difference? In other words, let's say somebody is like, I've seen people from like the hips up, they look normal, and from the hips down, there's something. So would that person be good for bariatric surgery, or just I guess take that much information and see if you can help me out.
Obesity is a complicated disease, and depending on your gender, the fat distribution is going to be different. A lot of times women will carry it lower hips, males will carry it more central abdomen obesity, and those are definitely things we take into consideration. Oftentimes it's easier to do the operation on women because their abdominal walls aren't as thick. Men tend to be more difficult to do the operation because
they have big bellies?
Because their abdominal walls are thicker, the muscle and the fat distribution, and we're using little incisions to get through that abdominal wall, and then if that abdominal wall is really thick, it creates a lot of torque on the instruments. The operation's still possible, but it does make it a little bit more difficult.
Oh, really?
If people have plastic surgery or liposuction, something like that, are they not a good candidate for bariatric surgery?
I have had patients who have had previous abdominoplasties where they've had a large portion of the fat removed from their abdomen, and I've still done the operation on them. It does change the anatomy of their abdominal wall, but the operation's still possible. It doesn't affect the inside of the abdomen. The more concerning patients are ones that have had previous abdominal operations, especially open abdominal operations, and sometimes they form a lot of scar tissue. And there have been instances where patients have had too much scar tissue in order to proceed with a safe operation.
Is a gastric surgery the same as bypass? Is a gastric bypass surgery the same as bariatric surgery?
Yes. So bariatric surgery is the encompassing term for all of the different types of bariatric surgery. And I think there are two main ones that I think are the most effective and most popular in this country, and that's gastric bypass or the sleeve, gastric sleeve.
So let's say there's two friends and they both went through New Year saying, okay, this is the year we lose weight. One friend says, I'm going to start jogging every day and eating right. The other one says, I'm going to go get bariatric surgery. The second one has to still eat right too. I mean, ultimately, they're both going to be doing the same thing, right?
Right. Exercise is good. It's encouraged. All bariatric surgery patients are encouraged to be a part of some type of exercise regimen. That exercise regimen is very important for their cardiovascular health. Now, we don't tell them to go exercise and they're going to lose a lot of weight. That typically doesn't happen.
Right.
It's a good adjunct and it's part of the program, but exercise alone is not enough.
So it's a food thing.
A lot of it is food. A lot of it is those patients' ability to metabolize that food, and these operations help them metabolize it much better. More patients with severe obesity, they are typically 100 pounds over ideal body weight, and it's not as simple as putting them on a diet and an exercise regimen. It's more complicated than that. And we looked at it. 95% of patients with morbid or severe obesity who tried dieting and exercise regained that weight within 2 years. So the exercise and the dieting is good, but it doesn't offer them that durability that they need.
And why does surgery offer it? What's the difference?
Surgery, the bypass and the sleeve, we're operating on the stomach, and it's creating a change in the way their body produces hormones. And it changes their gut hormone production.
Oh, really? It's a hormone thing? Mm-hmm. I don't think it's not sunk in before.
It's not that the surgery just helps them tolerate low-calorie diets. Their body is actually changing the way it produces hormones to help them better metabolize things like carbohydrates. And it does cause dramatic weight loss.
So when you use the word dramatic and people do lose the weight, you can't tone up the skin, so the skin is elasticized and out there. So then do you follow up with some kind of procedure where you remove that skin to make it?
Yeah, a lot of patients do seek plastic surgery after bariatric surgery. They do lose a lot of weight. Some of them are able to recoil some of the excessive skin. They have good elasticity and they don't have an issue with it. But there are those patients that have a lot of excessive skin after losing a lot of weight. It can cause pain. It can cause infection in the skin folds.
Oh, wow.
So there are different reasons why that excessive skin should be removed. It's not just cosmetic. There are a lot of benefits of having the excessive skin taken off, but they can't do that until a good 1 or 2 years after the operation, until they've gotten to the weight that they're going to be at. Then they can proceed with seeking plastic surgery consultation.
Does bariatric surgery confuse the internal organs, like your heart and everything? Do they have to reprogram themselves because you don't have all that weight on there?
Yeah, it's very positive effect. A lot of patients with severe obesity have hypertension, they have they have diabetes, they have high cholesterol, and the surgery helps a lot of those things. And I've had patients come in with uncontrolled high blood pressure on 1 to 2 to 3 medications. We do the surgery, and they're slowly coming off those medications because their heart isn't having to pump against all of that extra peripheral resistance, and their blood pressure goes down. That's one of the benefits of the surgery, is it helps resolve medical problems like high blood pressure.
So do you either of you know anybody that went through the procedure and had the success story? Do you know anybody, Lauren, that lost weight this way?
Not personally.
Through the doctor? You know some patients, right? You've seen some? Mm-hmm. Really? Give us a success story. Tell us about somebody.
I see it every day. One patient of mine came to me. She was BMI greater than 35, which is criteria for surgery.
Body mass index?
Body mass index greater than 35, yeah. And her main issue was very severe heartburn from gastric reflux. And I did the bypass on her, and her reflux resolved immediately. It was an immediate fix of her severe reflux.
Okay.
Another instance, a lady who was 150 pounds over her ideal body weight.
Right.
I did a bypass on her. She lost that weight and came all the way down to ideal body weight.
Wow.
It resolved her diabetes. It resolved her high blood pressure. It resolved her sleep apnea. And she didn't have to use her breathing machine at night to help with her sleep apnea.
Wow. Can I ask the age of the two people you just...
The first one was in her 40s. The second one was in her 50s.
Wow.
How about body odor? Because sometimes when things aren't going well internally, people have a different kind of fragrance about them. If people get really obese, do they have a different body odor, and then when they lose the weight, is it almost non-existent?
I think body hygiene is an important consideration. Morbidly obese or severely obese patients do have more difficulty with body hygiene, and losing weight, I think, does help with that. That's not a common complaint or question that I get asked often by patients, but it makes sense that if you lose a lot of weight, it's easier
You can reach easier
to maintain
Get
hygiene.
the soap in the places you need to get it to.
Exactly.
Darn, you put people out of business. They can't help you wash.
Leave Robin to answer the question. Nobody else ever. So, do people typically get motivated by cosmetics? In other words, they just want to look better, or, I mean, what? And this is a psychological question, maybe. I mean, but do you find that the person who's told you're going to look so much better is more motivated than the one who's told you're going to be so much healthier, or?
I think that the patient has to be realistic. This isn't cosmetic surgery. The weight loss is a nice added side effect. What we're going for with
health.
Bariatric surgery is health. We're looking to prolong people's lifespans. We're trying to reduce early death from stroke, heart attack, and kidney disease. And I think that's a really great goal. I think it's so much better than cosmetic result.
Oh, yeah, absolutely. Do you know Penn Jillette from Penn and Teller?
Yes.
The Magic? Okay, he lost a lot of weight. Have you seen him?
No. Did he have surgery?
I don't think so. I think he just decided to kind of go drastic and stop eating a lot. Like, he changed his eating habits, like, drastically. And he sort of didn't look so healthy to me last time I saw him. Hopefully he's okay. But we've actually I only use a celebrity because I figured you might be able to visualize
two
it.
celebrities that have been in the news recently about bariatric surgery, and I'm not sure what surgeries they had specifically, but John Goodman and Roseanne Barr.
John Goodman had it?
Really?
Yeah.
Weren't they married to each other? Oh, on TV.
On TV.
Yeah, and he does look a lot lighter. And I have seen him, but he looks good. I mean, he looks healthy. Penn Jillette, he looks like he's not so healthy. I have to find a picture of him. Yeah. Of course, it could just be a magic trick. I don't know. All right, let me take a little break. If you have any questions, by the way, Dr. Reginald Griffin is here. We're talking about bariatric surgery. Perhaps it's something you're thinking about. If you have a question, this is a good time to call. We'll take about a 3-minute break, and then we'll be right back. The number right now is 622-9622, and Lauren Debick is here also. And Lauren, you've got the number for them to call if they want to get the whole thing started without, they don't have to call the radio show. They call you, right?
That's correct. The health hotline number is 1-800-530-1188.
I wonder if it's embarrassing. Like somebody says, I heard the conversation. I need to lose weight,
Well, our health hotline is registered nurses on staff 24/7, so they would definitely be the people to talk to.
Definitely talk to them. Yeah, professionals. All right, well, let's take that break. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. Pleasant this afternoon, high 75 to 80. Partly cloudy this evening with areas of late night fog and a low of 51 to 56. Look for areas of fog tomorrow morning, otherwise variable cloudiness with a shower thunderstorm in the afternoon. High 76 to 80. Windy and not as warm Saturday. Periods of rain and a thunderstorm into the early afternoon. High 68 to 78. From the Florida Weather Center, I'm Holly Holdren.
When you go into Automax, Marion County's #1 pre-owned dealer for over 15 years, you won't take the new car depreciation because Automax saves you thousands on late model vehicles. Browse the inventory online at automaxocala.com. Then come down to see the great vehicles and upfront pricing in person. Compare up to 60 models inside the climate control showroom. So take your time. No high pressure, no gimmicks, no games. On the corner of 17th and Easy Street. Automax. Quality cars, outlet prices.
Sunrise Automotive, this is Matt.
Hey, Matt, it's Dan.
Hey, Dan.
Listen, we're going to be doing some traveling, and the wife, of course, is going to be doing a lot of shopping. I need to make sure the car is in good shape.
Why don't you just bring it on by? Let us check it out. We can check all your belts, your hoses, your tires, all your fluids. In out of town, is that up north in the cold?
Yep.
Okay, let's check your antifreeze. Also, let's make sure your washer fluid has got alcohol in it so it doesn't freeze up north, because that makes for a rotten day. And let's check your air pressure in your tires. Let's look at your brakes, make sure everything is safe safe and secure there. Let's go through it and just make sure everything is ready to go on the road. You due for an oil change?
Yep.
Whenever you come in to get your oil change, we always check your belts, your hoses, all your lights. We go through and make sure that everything is working properly. We check all your fluid levels. We do that every time you come in to Sunrise Automotive.
So just call you back at this number?
Yeah, just give me a call back at 690-1993 whenever you're ready to come in. And you can drop it off, leave it with us, whatever's most convenient for you. Look forward to seeing you at Sunrise Automotive.
Hi, I'm Big Daddy Don Garlitz, asking you to support adoption by purchasing a Choose Life license plate from your county tag office. You know it costs a lot to give a child life. Many times a woman is forced to make a bad choice because of financial pressures. Help save the lives of the unborn children by aiding women whom choose life instead of abortion. Take a stand for life. Purchase your Choose Life license plate today. For more information, go to chooselife.org or call 352-624-2854.
Cookies, 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 cookies. We go cookie eating cookies.
When you want something special and fun for any occasion, get cookies. King Cookie in the Paddock Mall in Ocala will make a delicious, fun-filled delight just for you. So next time you're in the mall, stop by King Cookie or call 352-237-2557. KingCookieOcala.com. Customized cookies, cakes, and more. King Cookie.
Eating cookies. We're so happy eating cookies. Cookies!
21 minutes after 11 o'clock. Thank you for tuning in. Beautiful Thursday out there. Almost done with the first week of 2017. If your New Year's resolution was to lose weight and you've considered bariatric surgery, if you have a question, right now is a good time to call in. Lauren Debick is here, and Lauren's guest is Dr. Reginald Griffin. Dr. Griffin is with the Concierge Bariatrics. Is that what we call it?
Correct.
And it's all part of Ocala Health, right? It's all part of the big family of health. You got a big crane over your hospital now, by the way.
That's right.
That thing is gigantic. How did they get that there? Do you mind if I ask that?
I honestly don't know.
They must have put it together there.
They could have.
I mean, how could they bring down?
They know what they're doing.
Can you imagine that going? If that was have you seen it?
Yeah, they had another crane put that crane on.
Yeah, that's amazing. You don't usually see that in Ocala, right? The big gigantic.
Yeah, it's at West Marion.
Mm-hmm.
Yeah, it's the right hospital, right?
Yes.
You work there too. Okay, it's unbelievable. Okay, so I mean, could a kid climb up there and just like put American flag or something up there? Because I always think, somebody's going to.
They will now.
Yeah.
I thought if I did, I would fall off. But somebody a little more limber, somebody could do it. All right. So where exactly is Concierge Bariatrics?
I'm located off 17th Street, behind the two-story Regions Bank, right past the duck pond.
And did I ask you why Concierge? Did I ask you why the name once before?
Yeah, once before. Concierge is a way of focusing on the patient, giving them all-encompassing care, really paying attention to detail, and being available.
During the break, you mentioned the psychological aspects of, I don't know if it's of losing weight or of losing weight through bariatric surgery. I'm guessing it's just losing weight based on everything the three of you were saying. Suddenly we look better, The ladies are hitting on me more.
That's right.
I'm looking forward to this, Robert. and then we drink more. This could be good for me.
That's right.
No, I'm teasing. But I mean, so you said prior to the surgery, all the patients go to a psychologist, is that right?
Yeah, it's a quality measure. We have to have each bariatric surgery patient be evaluated by a psychologist or psychiatrist. We have to make sure that they're compliant because they do have to follow a very specific guideline of diet after the operation.
Really? So the psychologist gives a report to you that says this person can handle losing the weight.
Right. They have the mental capacity to go through the surgery and follow instructions.
Gosh, I'd be so embarrassed to fail that test. Imagine if I had a meeting with you after the psych and I said to you, well, what did she say? I'm assuming it's a she.
Yes.
I'm going to open up to anybody. And she doesn't think Larry can handle it. I mean, can you imagine that? I'd be embarrassed.
And we have to listen.
It has happened?
Yeah, it has happened.
And how do you tell the...
In those instances, we offer them medically guided. So we still care for them, but we just offer a different approach.
Medically guided? Okay.
Yeah, because people, once you feel you look better, you feel more sexy, and then you go out and you do things that you normally haven't. And you brought up the issue of alcoholism.
Certainly.
Well, partying and things.
That is an awareness we have to have with bariatric surgery patients. Sometimes in support groups, patients will bring up issues of alcoholism, and that's something we have to look out for. After bariatric surgery, the body can be more easily intoxicated with less amount of alcohol. So they're more sensitive to it, and they're more apt to developing tendencies of alcoholism. This it's rare, but we do have to be aware of it.
And your partner has been there with you all these years through the changes, and then suddenly you feel you're more beautiful, and then you abandon your partner.
There are emotional changes that can happen after the surgery, and it goes in stages. Initially, the main emotional problem is the patient's food habits. Before they had a great relationship with food, they were able to eat whatever they wanted. They didn't have to worry about it. It was fantastic. And then they go for surgery and their diet's changing, and all of a sudden they're having to break up with those old dietary habits. It's like ending a fantastic relationship. So that does take an emotional toll on those patients.
We are all mini experts on so many things. We think we are anyway. And so one of the ways we become experts is with the internet. The other way is because we had, great Uncle Charlie, 20 years ago had this procedure, so I know everything about it, right? So talk to the person who great Uncle Charlie had it 20 years ago. What's different today than then?
Back then, they were doing it open. They were making a bigger incision. The bypass has been around for decades, probably the 60s at the earliest. So it's been around the longest, but it was being done open up until about 2000 when it converted, everything in bariatrics converted to small incisions or minimally invasive.
It's amazing, really, that you can even do that, yeah. All right, so if somebody wanted to consider this, they get the ball rolling, they call you, Lauren? Is that right? No? They just call the doctor directly?
Oh, they can call me directly. They can call Ocala Regional.
Oh, so this doesn't have to be, referenced by a family physician?
Ocala Health Hotline.
I think that's very important. If a patient is considering bariatric surgeon, their primary care doctor does need to be on board with that. They need to provide medical clearance. We don't keep any secrets from the primary care doctor.
Okay, yeah, I would think that would be a nice safety net or something, just so you know.
If a person is having problems with their hips, and then the doctor says they have to have hip surgery, but they're overweight, do they need to have this procedure done first and then the hip surgery, or do you set them on a nutritional path where they can lose the weight? How does that work?
That happens quite often. The patient is severely obese. That extra weight is adding a lot of pressure on their weight-bearing joints, the hips and the knees, and oftentimes they do need a hip or knee replacement. But it's high risk if they are severely obese. So they come to me, we do the bariatric operation, a sleeve or a bypass, they lose a lot of weight, then they get their hip or knee replaced. And they have a better outcome from their hip and knee replacement.
Oh my.
What I really think was amazing is that in addition to losing the weight, there were the other residual positive things that happened, like you said, lower blood pressure, diabetes went away for that one lady, and it sounds like less weight on your weight-bearing joints, those problems could go away, right?
Definitely. Obesity affects every single organ system, and from the brain to the joints.
What does it do to your brain?
There are females who have chronic migraine headaches secondary to obesity, and it helps.
Really?
We do see improvement in that after the operation.
Wow.
And this also weighs in on the embarrassment factor, because sometimes children don't like to see themselves with their parents if their parents are overweight. And so this would really be beneficial for the family health, too.
It is. I think a lot of times we probably feed our kids too many carbohydrates. I think it sets them up for obesity. And if one of the parents is going through this process, it changes their diet, and I would hope it would change the entire household's diet.
Dr. Griffin, thank you for coming in here and sharing your expertise with us. Lauren Debick, you always bring the best guests. Thank you so much for coming in here and doing what you do. And real quickly, what's the nurse hotline again?
It is 1-800-530-1188.
All right. Good to see you both.
Thank you.
Happy New Year. Call us if you need that number repeated. Share the video, the podcast with anybody who you think might benefit from it, and call us if you need the number. Thank you. We'll be right back.
Fox News Radio, I'm Lillian Wu. The U.S. intelligence report on foreign meddling in U.S. elections has now gone to President Obama. The same morning, the Senate Armed Services Committee hearing from intel officials. National Intelligence Director James Clapper